CPR saves lives. But safe training starts with clean CPR mannequins. During CPR training, the same manikin is often used by many participants. That's why hygiene is essential to reduce the risk of transmitting bacteria and viruses. Brayden CPR mannequins use a lung bag that causes the chest to rise when air is blown in. This lung bag should be replaced regularly, ideally after each course or trainee. Firstly, the O-ring should be cleaned. Use warm water and a mild detergent to disinfect it thoroughly. Here's how to replace the lung bag. Detach the old bag and fit a new one as shown. Be sure to also replace the air filter. Next, take apart the valve block and remove the internal plastic filter. This should be replaced with a new one as well. All components of the valve block should be cleaned before reassembling. Once reassembled, insert the new filter, then attach the new lung bag. It's equally important to clean the facial skin of the mannequin. Use a mix of warm water from 60 to 70 degrees Celsius and detergent, and allow it to dry completely before storage. To protect your mannequin from damage, store it properly in the provided bag after each training session.